Hello, this is Dr. Grande. Today the question is the ADHD epidemic real? So ADHD stands for Attention Deficit Hyperactivity Disorder. And this is a diagnosis that we usually think of as occurring in childhood, but it can, of course, occur when someone is an adult as well. And we've seen an increase over the last few years in the number of cases in children and in adults. So specifically talking here about children and the rates of ADHD. Some years ago, the prevalence of ADHD in children, school-age children, was about 4%, 5%. And depending on what research you look at now, it's between 10 and 15%. We've also seen a dramatic increase in the number of stimulants prescribed to treat ADHD. So there are several schools of thought about what is happening here. I'll divide these schools of thought into three major categories, although I recognize there are other opinions that would necessarily fit into one of these categories. So the first theory is that this whole time along, the true prevalence of ADHD was never around 4% or 5%, that it was always closer to 10% or 15%. And we've just become better at detecting the disorder. So educators, like high school educators or elementary school educators, are more aware of the symptoms of ADHD. Parents are more aware. And mental health clinicians and prescribers are getting better at diagnosing ADHD. So that's the first theory. So we're now discovering more of the cases of ADHD. The instruments, the methodology for diagnosing, they're more sensitive. We are doing a better job at finding ADHD. That's one of the theories. The second theory about what's caused this epidemic in ADHD, the so-called ADHD epidemic, is that the number of cases actually increased from around 5% to between 10 and 15%. And that this increase was caused by the introduction of video games, more use of television, smartphones, a lot of electronic devices that change the way that children interact with the environment because of the type of stimuli provided by those devices. So with that theory, the number of cases has simply increased. And there's other theories about inside that theory about what the causes could be, not just electronic devices, also pollutants, toxins in the environment, and other environmental changes. So there's a lot of different factors that could have resulted in a true increase in the number of ADHD cases. The last theory is that there is no ADHD epidemic. And in fact, the number of legitimate cases of ADHD has been relatively stable over the entire amount of time that we've had this diagnosis. And that we have pathologized normal child behavior. We've taken the idea of being disruptive or hyperactive or having trouble concentrating or fidgeting, and we've turned it into a mental health disorder. Now, with this theory, of course, the theory recognizes that there are legitimate ADHD presentations. ADHD is a real diagnosis, and that many people do have it, and that it's treatable, and the treatment is usually helpful. What this theory is saying is the number of cases we have minus the number of legitimate cases, that this difference, that what's left over, is a result of pathologizing normal childhood behavior. So we've taken these different behaviors that would be normal, and they're not acceptable in school settings, and sometimes in home settings and other settings, and we've made this into a pathology when it shouldn't be. We've expanded ADHD into an area where it doesn't belong. In order for diagnostic criteria and the use of diagnoses to be useful, they need to capture only legitimate presentations of a disorder. and not expand beyond those boundaries. But that is one of the theories about what has happened. What this last theory is saying is that the number of cases of ADHD that we see is inflated, that we've pathologized normal behavior for children. We've taken these behaviors and we've said now we're going to put a mental health condition, mental health disorder as a label for them and try to treat them, try to make them go away. Try to eradicate behavior that children exhibit on a regular basis because it doesn't fit with the expectation. It doesn't fit with the educational environment in elementary schools and high schools, for example. This theory, to me, in my opinion, offers the most reasonable explanation about what has happened. It seems unlikely that a disorder like ADHD would rapidly expand in a short time. And we go from around 5% to around 10 to 15% that quickly. There's really no evidence to support that ADHD should be on the rise, certainly not to that extent. And if we look at the school systems and the expectations they put on children, for example, sitting still and not talking for 6 hours, this seems fairly unrealistic based on how children normally behave. ADHD is conceptualized as a disorder that a child would have, and I think you could look at it legitimately and say it could also be a disorder of the environment, a disorder that the environment has. The children are normal, and the expectations of the environment are what's unrealistic. Now again, there are definitely legitimate cases of ADHD, and this last theory is not talking about those cases. Whether talking about ADHD in children or adults, there are many legitimate cases. And those cases necessitate treatment, and again, treatment works fairly well in many of the presentations of ADHD. But all these other cases, this mysterious increase in ADHD, seems suspect. I'm skeptical that this represents a true increase in the prevalence of ADHD. There is evidence that supports this theory, and when we look at how ADHD is diagnosed and how old a child is when it's diagnosed compared to other children in that same school year, we see that younger children are more frequently diagnosed with ADHD. And we also see that, given time, many ADHD symptoms will resolve. So perhaps the cure for many ADHD cases is just allowing children to mature naturally, instead of trying to impose stimulants and other medications to rid a child of these normal behaviors. Now again, I know this becomes difficult when trying to decide what's normal and what's not, and what's disruptive and what's not. And one of the popular components of this theory that we've seen is blaming the Diagnostic and Statistical Manual, blaming the definition of ADHD and saying it's too broad and it invites overdiagnosis. However, if you look at the DSM and the way the criteria are outlined in the explanation for the diagnosis, the different symptoms, the different criteria that would have to be met would need to be inconsistent with the developmental level of that individual. And the argument that this last theory is really making is that a lot of these criteria are consistent with the developmental level of children. And perhaps the misdiagnosing, perhaps where the error is being made, is in not understanding that phrase, that inconsistent with developmental level phrase. And that needs to be given more consideration before jumping down and looking at all the symptoms and checking them off and giving somebody a diagnosis of ADHD. So again, a few different theories of what's causing the so-called ADHD epidemic. In my opinion, there is no ADHD epidemic, meaning there is no true increase of this disorder, but rather it's a product of our expectations and the environment. I hope you found this description of the ADHD controversy to be interesting. Thanks for watching.